Hi, everyone. Welcome to today's webinar. I'm Jenna Sylvia from VSOT, and I'm just going to give everybody a couple more seconds to join the webinar before we get started. All right, let's get started. So today's webinar is titled Unlocking Contemporary Insights for HSPAL Residents. I'm just going to go over a couple housekeeping things before we get started. First of all, we will make this recording available after the webinar is over. We'll send you a follow-up email. Along with that email, you'll get a survey, and we'd really appreciate you guys fill it out just to indicate how valuable and how well our speakers did today. And then we will save all our questions for the end of the webinar, but you can submit them at any time using the Q&A function. Without further ado, I will get started. So our presenters today are our VSOT CEO, Steve Rough, and our VSOT Senior Director, Dave Hager. And I'll hand it over to you, Steve.
Yeah, well, just thanks, Jenna. Do a few quick introductions. My name is Steve Rough. I am CEO of VSOT. I've been with VSOT for 3.5 years. Prior to that, I spent most of my career as the pharmacy executive at UW Health in Madison, Wisconsin. Thanks for joining us today.
Yeah. Good afternoon, everyone. My name's Dave Hager. I'm a senior director here at VSOT. I've been with VSOT for about 2 years now as a senior director. Prior to that, I got to spend some time with Steve at UW Health, where I was director of clinical pharmacy services.
So, before I get into VSOT, a little bit more about VSOT, a little bit about HSPAL residents in general. It's something that, to Dave and I and many in our at VSOT, it's near and dear to our hearts. We owe our careers to HSPAL residency training and our involvement with residents throughout our careers. At VSOT, we have 20 past HSPAL residents engaged as full-time members of our team, and we also have 5 prior HSPAL RPDs on our team as well. So we certainly understand the importance of, believe in, and do everything we can to provide support to HSPAL residents during the residencies and thereafter as well. Today's webinar, we have about half the registrants are current residents. The other half are pharmacy executives or leaders in the profession. So it's great that we have a good diverse group today, and hopefully we can have some good questions towards the end from both residents and current leaders. Quick little bit of overview about VSOT. We have a very clear mission, which is to positively transform healthcare through pharmacy. We are the best-in-class pharmacy solutions provider for hospitals and health systems. We offer highly specialized pharmacy consulting, advisory, and implementation support services to accelerate operational and financial performance improvement for hospitals and health systems through pharmacy. So we provide overall strategy and implementation support across the spectrum of hospital and health system pharmacy needs, and work very, very closely when we engage with our clients to bring cutting edge strategy, enthusiasm, and implementation support to elevate and optimize pharmacy success. We routinely engage with hospital and health system pharmacy execs and their C-suites to advocate for our clients to build clarity and focus around hospital and health systems pharmacy's value and what can be achieved if they look at pharmacy and positioning pharmacy a little bit differently in the organization, invest in it differently to position it as a strategic asset to drive and optimize value for the hospital and health system. So we are here, what we believe in is investing in pharmacy. It's great for patients, it's great for healthcare, and we partner with our clients to help them build stronger pharmacy programs. So if we move on to the next slide, Dave, I'll turn it over to you.
So thanks, Steve. That's a good overview of what VSOT is able to provide. If we go back to a little bit about kind of where our HSPAL friends may be in their overall journeys, I think right now it's like the height of their kind of recruitment season. So I saw some names on the participant list, and I know some of you are in that active season of life where you're going to go on some of your first like real job interviews. There are also probably a lot of people on the webinar today who have been through that season before. And, I think one of the questions that at least I used to like to ask leaders that I was going to bring into my organization is this one on the screen. What contemporary issue are you following, and how do you think it's going to impact your next year? And I think the reason I like to ask that question is really to get at how does this leader really stay contemporary and understand the issues that are going on in our profession, and how deep can they go? Are they people who are just reading the headlines only and that's about all they know, or are they really trying to go deep on what are the main issues in our profession? I always thought it was fun to do this. I did it recently again for some interviews we were doing with a client, and one of the most common answers I've heard over the last 3 years is provider status. Provider status. Got to talk about provider status, hottest topic in the profession. And when you'd ask like 4 questions about provider status, you learn a lot about how far they had gone on that issue. And I won't get Steve going today on his thoughts on provider status as a contemporary pharmacy issue, but you'll not see it in our top 10 this year. That is for sure. So I guess that's where we approached this webinar and why we timed it here is I think one of the things that we need to do as we transition as HSPALs out of our 2-year programs, or if you're a PGY1 entering your 2nd year administrative residency year, one of the things you're going to have to develop skills in is being able to go deep on these issues, because you're not going to have a preceptor telling you, like Steve used to do for me and for our residents, to say, here are the things that you need to be focused on in this coming year, or here are some of the things that you need to be learning about because these are the hot topics in the profession. If you don't have those people around you anymore, how are you going to stay contemporary? So if we go to the next slide, we can kind of dive into that topic a little bit more deeply. So this is some free professional development advice, not necessarily related to our top 10, but I think the top 10 kind of plays into this, which is, as an HSPAL or as a professional, how do you want to stay current? How do you want to know what's going on in our profession? One of the things that Steve told me early in my career is every 2 to 3 years, have a new area that you're going to be an expert in, and be that expert, and go across the country and talk on it and challenge yourself to understand those things. I took that advice to heart, and I think what I'm trying to put on this slide is exactly some of my similar thoughts about what you should do. And I think the first is to have a continuous learning approach. So have a plan to continue to grow. So as we exit, the sort of tight structures, right, of a residency program where, again, you have clearly defined learning objectives you have to get after, you're going to have to do some of that work on your own. And what that really looks like is putting together that plan of figuring out what your opportunities are, putting a plan together to go after those opportunities, figuring out how you best learn, then go and learn the things, evaluate if you got something out of it, and then kind of continue that cycle. I think the second key part of staying current is growing your network. And I think right now is like a critical juncture for a lot of you all as administrative residents, because you're going through another kind of career transition. You've met a lot of people and made a lot of connections through your time in pharmacy school and through your residency connections that you've made either locally or nationally. Have a plan for how you're going to stay in touch with those folks. Because through that network, you're going to understand what is going on within our industry with people that you're close to. Figure out what your future is for professional associations, and decide what your strategy is in LinkedIn and other areas. And then I think the third major bucket in terms of how we try to stay current is how you're going to scan the environment. So how do you get those broader perspectives, maybe outside the industry or deep within the industry, that have a national perspective? And that's where you want to use journals and podcasts and listservs, have a plan for local and national news. And I think you're going to need a way to make sure you build in time to get after those. So I think, when I used to ask this question around what's an issue and how you stay current, what I was trying to get at is, how do people really approach their strategies to stay current moving forward. So I think with that as background, we want to talk through the top 10 as maybe one of those tools in your toolbox. And I'd love Steve to kind of talk through the history of that.
Thanks, Dave. And I agree with you about networking and staying current. It's vital to one's career. The fourth thing, if we had to add to that, would be, engaging in the most meaningful work of pharmacy through professional organizations, and it can be state level, national level. But I've always found that the more you give to pharmacy, the more you get back. More you give, the more you get. And I think that rule always applies and will always apply throughout your career. So I'd encourage you to, no matter how busy you think you are right now, you will get busier. And it's always important to stay engaged with something and try to be the person that gives the most when you do engage with the profession. And you'll find your networking, your connections, your environmental understanding, just because you take the effort to stay engaged, will put you at the top 5% of your peers nationally when you choose to do that. And in terms of speaking of giving, one of the things VSANT we like to do is we like to give back to pharmacy leaders, and we are currently at any one point in time actively engaged in over 100 hospitals and health systems nationally. And through that work, we see a lot. We learn a lot. We see what challenges are impacting pharmacy leaders. We see what unsuccessful strategies are. We see what successful strategies are. And we know that in today's environment, pharmacy leaders probably and pharmacy residents are daily bombarded with competing priorities and challenges. So through the top 10, it's an annual publication we put out in January of each year. We share what we're seeing, what we're learning, to try to help our pharmacy leader peers be successful. So you can look for it each January. It's always the 10 issues that we think are most important to prioritize. And it always comes with a very positive tone. We've always felt, whenever there's challenges, that means there's opportunity. And at this point in time, we view the opportunities in pharmacy due to the amount of dollars, the amount of impact pharmacy has on patient care, and the amount that high-performing pharmacy can have on the organization achieving its overall goals. There's never been a better time to be a pharmacy leader. There's never been a time to be an up-and-coming pharmacy leader. As an HSPAL resident, we see a very uplifting vision for the future, and hopefully you can take, we spent a lot of time publishing the top 10, crafting it, being very careful so that our peers can leverage that in their own strategic plans, leverage that internally to advocate to executives to try to get the resources you need to expand services. So it's one of the ways we give back to the profession. We go to the next slide. So every year the top 10 changes. I'll tell you that from year to year, there are some things that stay the same. For example, workforce was one we talked about last year, but this year we put a different spin on it. But these are the top 10 topics that we see this year. And the ones highlighted in bold are the 4 we're going to focus our time on today, because we don't have time to go into depth on all of them. But real quickly, the top 10 issues that we saw as opportunities for pharmacy this year. Number 1 is advancing workforce. Number 2 is growing one's internal specialty pharmacy program to drive revenue and better patient care for the organization. Third is expanding your ambulatory infusion footprint through implementing ambulatory pharmacy infusion suites built under the home infusion benefit. Fourth is getting much more engaged in understanding and driving value for the organization through pharmacy revenue cycle improvement. Fifth is collaborating through aligned incentives with pharmaceutical manufacturers to drive value for the health system. 6, not so much an opportunity, but something to be aware of, is the amount of private equity investment that's occurring in healthcare and what that means for health systems. 7th, continuing 340B program headwinds. 8 is grit, and that's the first time we've written about grit, but we find there are certain skills that the best pharmacy enterprise, no mistake, success in pharmacy boils down to leadership. Without the right leaders, with the right passion, the right attitude that can attract the right leaders, great things don't happen. And so it's important that leaders have grit and have certain characteristics to drive long-term success. So we wrote about that this year. 9, we talked about efficiency. We do not believe at VSANT in shrinking pharmacy to greatness. It's not possible, but there are efficiency challenges that we see Big consulting companies being brought into health systems to reduce headcount, for example. And there's a lot of effective strategies. Pharmacy leaders, the more you understand about that, the more you can protect your resources and grow rather shrink in the face of that. So having an efficiency mindset is important. And lastly, drug prices can continue to go up, and there's ways to work to minimize drug costs, but to leverage that to drive pharmacy's value proposition. So those are our top 10 topics, and now Dave will review the 4 priority ones.
Yeah, so I was just at a state conference yesterday, and certainly the number one topic remains this one around workforce challenges. And obviously our focus was within pharmacy, although the breadth of those challenges are across the whole healthcare sector and probably beyond, frankly, when you look in other areas of workforce as well. And so we had that again on our top 10 list this year, and I think will be relevant for HSPALs as they transition into their first jobs in 2024. So if we look at the next slide, we really look at it in 2 different ways. And so again, our vision is really the positive aspects. It's like, well, what's positive about the fact that we have workforce challenges? Like, and I think I saw it in 2 different veins as I've worked with our partners across the country. The first is kind of re-looking on the inpatient pharmacy side. And so many of us have been involved in practice advancement for many years. And as inpatient pharmacists, as a transplant pharmacist myself at one point, I thought we did a lot to kind of argue for our role within the healthcare team. And oftentimes that meant kind of taking on the work that people would let us do and saying yes to things, saying yes to a lot of like unfunded sort of mandates to grow our service so that we could establish ourselves, on the healthcare team. And, I think practice advancement 2 has really looked at, all right, what are the new services that we need to add to our department? What are the new clinical activities that we need to tack on to our existing model? But boy, we're not going to be able to get more resources. So how do we do that advancement in the face of no additional headcount? And I think what workforce looks like in 2024 is on the inpatient side is how can we get back to the basics of understanding what our organization expects out of our pharmacy department? What resources do we have? And then how do we meet those expectations or exceed them? And then how do we advance our practice by getting deeper in our core areas and being an essential part of the inpatient team and workflow and be able to care for our patients in all settings? And when we do that, that may challenge us to look differently on how we train and utilize our pharmacists in order to meet those needs. So winning on the inpatient side, I think, again, early in 23, it was like the focus was on work from home and working conditions and a number of other things, kind of about how we did the work. And I think in 2024, it's going to need to get to what are we doing on the inpatient side and why are we doing it? I think on the ambulatory side, if we just switch gears here, I think the workforce challenges also present opportunities in the retail space and in the ambulatory pharmacy space. With a lot of our clients across the country, we see one of the challenges is the shrinking footprint of community pharmacies as those stores have to close as a result of workforce shortages or other issues. That leads to not only transitions of care issues for health systems and their patients, it also means opportunity, I think, for hospitals and health systems who offer a different level of service in some ways because of their connection to the medical record, their kind of innate incentives around patient outcomes, and their ability to more quickly communicate back with the interprofessional team in order to make positive change happen for their patients. And so as we think about practice advancement on the inpatient side, I think at the same time, we have to be looking at our retail and ambulatory footprint in the face of what might be happening in our market and what are our opportunities to fill those needs within our communities and service those patients in new ways. And so while we have workforce challenges, I also see it as a lot of workforce opportunities for us in the future if we can, I guess, right size expectations and our staff needs to meet the organization's needs and our community's needs. I think some other pieces then that are tied to that is really, I haven't focused enough in those previous slides around technicians. And I think one of the things that Steve and I have done together for a variety of years is really have a focus on how do we make technicians into a career, and how do we use organizational incentives to help keep our technicians in their technician roles and provide them more advanced opportunities to care for our patients, improve the skill mix of the organization in which we work, and also give them kind of increased professional capacity. And so I think one of the other areas that we'll focus on in 2024 and beyond is that role of the pharmacy technician.
So, Dave, maybe I could ask a couple questions
Yeah.
about workforce topic to get maybe spark people's thinking. It seems to me that since the pandemic as a profession, we focused a lot on protecting our workforce. There's a lot of talk about well-being, about balance, about burnout, right? And those are all things that are important. But it seems like now we're recommending, and what we're seeing is the most successful pharmacy departments are repurposing that vision around how do we repurpose our staff, our employees, the work our pharmacists and technicians do, so that we can demonstrate more value through our workforce and being innovative about that. And this is the second year in a row workforce has been in our top 10. And I just feel like we see pharmacy leaders getting stuck, right? There's growing demand to expand pharmacy services, yet financial and workforce pressures are opposing that aim and opposing the vision of pharmacy leaders. So what are there one or two specific tips or advice you have for leaders on how to respond to their vision of expanding workforce success in the face of all the challenges that they're facing?
Yeah, I think the first step is to really understand what your organization's priorities are from the pharmacy staff that you have today. And I think we need to challenge ourselves to get really clear on what the organization wants. Steve and I, when we talk to leaders across the country, we see a lot of mission and vision and strategic plans that are so broad, it's really hard to know exactly what the strategy is. The strategy appears to be care for patients, right? And try to lower the total cost of care or something along those lines. And so being really clear on what is it that priority is for our department, and then inventorying what is it that we have grown over time to take on, and are those activities really activities that A, add value, and B, really need to be done by a pharmacist. All over when we engage with our partners, we see pharmacists doing medication access work, engaging in work that we know, doing transitions of care activities that we know, and data shows that pharmacy technicians can do as well, if not better, than pharmacists at a fraction of the cost, and provide opportunities to grow their careers. And I think understanding what we can give up and stop doing, and also understanding what our priorities are, I think is really going to be our first step in really understanding how we do this. I'd also say we may need to think longer term about some of the solutions. I think if we look at the workforce pressures, I think there was hope that we would kind of salary and benefit our way out of this problem, but the pipeline needs to grow as well. And I think we're going to see more entrepreneurial, forward-thinking organizations think way earlier in the career pipeline for how they're going to source employees than just worrying about how they get residents in and how we broaden that pool. They're going to be thinking at the student pharmacist level, the student level, the high school level and below in order to build that workforce across all of the healthcare disciplines.
Thanks, Dave. I appreciate the detailed response, and there will be opportunities for others to ask questions or make comments or share suggestions around workforce. But I think the bottom line is it has to be a top priority to leaders.
Yeah.
Time is now to set the bar high, right? No one rises to low expectations. So set expectations high for your team. Find those informal leaders in your department that can step up and help drive some of the practice changes forward, and then they'll become more formal leaders in the future. So
Great.
appreciate it. All right, we can move on to the next topic.
All right, the next on our big four for new leaders is really the opportunity within ambulatory infusion. So what we're seeing is, and I think if we zoom out for a minute, there are a lot of infusion programs in this country that started really with a focus on oncology. And so oncology infusion became the dominant part of the industry that pharmacy tapped into. Okay. And so we see a lot of infusion structures that are focused in the oncology space. And that's been good for pharmacy, right? There are a lot of high-risk drugs, a lot of high-risk patients that need pharmacists' care in that space. At the same time, I think that sort of singular focus has kind of blinded us to the opportunities that have emerged for non-oncology specialty infusion. And so these drugs may not carry the same risks, but they are still complex drugs. They're complex biologic products that carry a big price tag, and making sure that they are infused in the right space and that business is captured within our health systems, I think has never been more important. We've talked before in some of the work that VSON has done about how kind of ambulatory infusion is the new specialty pharmacy. And I think that is still true as we work across the country. There are some of these infusions, right, that if you are capturing them within your infusion centers in the right side of care, they're worth a lot of value to your organization. And I just don't know today that many organizations think about it that way. They do think about it in the oncology space. They don't think about it in the non-onc specialty infusion space. And we just don't have the administrative structures, the prior authorization structures, the other things to support it. And what that has meant is that alternative sites of care set up by private equity and other groups has filled that gap for us. They saw that opportunity pretty quickly, and they've been quick to act. They also have been able to provide something for payers that many times our health systems haven't been able to offer them, which is a lower cost site of care for these high cost specialty infusions that don't carry as much risk as oncology infusion. And so they're able to provide a cheaper site of care with a higher focus on customer service and kind of customer environment of care that makes it pretty appealing for both patients and providers and payers to get that business into those other sites. And so we see real advantages in health systems being able to maintain that continuum of care. Those are your patients at the end of the day. They're your patients being prescribed high-risk drugs from your providers, and you'd probably prefer to have that documentation about the medications that they're being infused and what is happening to them and whether or not they're getting efficacy out of those treatments and any side effects within your medical record. And some of that is leaving your health system today if you aren't able to provide all of the different sites of care within your health systems. And I think that is going to require a system strategy. And part of the reason I put it really on this list is I think as new administrative residents that might be in new roles, this would be something I would explore. I would try to understand within your new health system, how are those infusions managed? Who's in charge of those? Is it individual provider groups? Is it individual nurses and nurse managers within the clinics? Are there service line administrators? Who controls and who's being thoughtful and strategic around what is happening in the specialty infusion space? And is that an opportunity for pharmacy to step in and provide a strategic solution and direction in that space? When I think about getting started, these pharmacy ambulatory infusion suites are a really, like, I think, optimal solution for many of the challenges I just described. And that it all hinges, of course, on medication access and making sure we can get patient access to the medications around site of care restrictions in the right place. I think one of the things that we faced a couple of years ago was extreme financial challenges across our hospital and health systems. And that led to like a lot of pressure on capital. And I think there was a perception that trying to get into this infusion suite space would be a barrier as a result of that. This is an attractive solution because it doesn't require a ton of capital. It's not an HOPD infusion, so you're not held to those type of hospital standards for care. And spaces become more readily available than ever before as we've moved to new models within the workforce space. And I think right now is the time to really put together that strategy to collaborate with your senior leadership team, with your medication access teams, with your infusion leaders, with medical leadership to say, what is our strategy in this space and how are we going to like give this work to someone and have them like go and carve out a strategy and actually go after a market. And I think that's what's exciting about this space too, is you get to be more entrepreneurial and to actually do some strategy to say, all right, how are we going to attract patients back into our sites of care? Where else can we get patients, outside of our health system, back out in our communities into our sites? And I think that's an interesting new place for us to play in, which is like really in that strategy place again. And to me, it does feel like the early days of pharmacy or specialty pharmacy in some ways.
Dave, I think your comments about that are spot on, and this is where our top 10, these areas all overlap. None of them are in silos. And I think about the topic about grit and the topic about ambulatory infusion suite opportunities. It was about 10 years ago that I was working with my peers. Specifically, I remember John Armistead, Rita Shade, and I trying to get people across the academic health system world excited about starting up specialty pharmacy programs because that was the future. And people looked at us like we were crazy. And there were leaders that didn't want to do the work. They knew maybe they should do it, but they didn't want to do the work to make it happen. And if you're a resident and you don't understand what's going on in the non-hospital HOPD environment, what your making sure your organization has a strategy around it, you're missing a big opportunity. And you're going to miss out on understanding an area of practice that's going to be vital to your future success if you want to be a chief pharmacy executive in the future. So, Dave, I think your comments are great. And we're working with a number of clients in this area today, helping them implement and optimize their ambulatory pharmacy infusion programs outside of the hospital. And despite all the benefits, we often see confusion, angst, even pushback throughout the organization when we try to drive this programs forward with pharmacy leaders. So Dave, what are some of the biggest barriers that you think leaders might anticipate as they try to push this strategy forward for expanding ambulatory infusion footprint outside of the hospital? And what's maybe a strategy or two you might have for them to address those barriers?
I think the hardest barrier we encounter is the dissonance between, we know, right, that there are site of care restrictions, right? If any of you work in that space that are pushing your patients out your doors today, so that it's business you have already lost. Those are patients you've already not been able to care for. And so the claim would be, the argument is, let's set up that site of care for us to like back insource those patients back into our system. And that makes sense, right? Like what we often see in terms of pushback is contracting or rev cycle or somewhere in that group, someone says, well, wait, if we offer these solutions, then we won't be able to negotiate the same type of HOPD infusion prices that we get today. And to me, it is like sometimes the relationship between pharmacy and that like managed care, contracting, rev cycle group that controls those decisions is they haven't worked on this type of stuff before. Those relationships are just not well established. And I think that can be a barrier. And so I think we're going to talk about in a minute or two here that this focus on rev cycle, but I think understanding your managed care contracting group, what their priorities are, where they are in their cycles for those types of contracts, and being able to show them the distinctions between HOPD infusion, physician office based infusion, pharmacy based infusion suites, and why this is the right choice out of a kind of a sea of confusing options is a good place to start. And then giving them resources for how that contract negotiation would look, because we're often pushing them to do negotiations they're just not, they haven't done a ton of times before. Certainly home infusion type contracting is not something that they've been asked to do. And many of you probably have experienced before. If you ask a pharmacist to do something they've never done before, sometimes you get emotional pushback, even if you know they can do it. And sometimes we need to help coach those colleagues through it. And having a good relationship, I think, with your managed care contracting team is a good place to start.
Thanks, Dave. Great advice. All right, let's move on.
Like I said, let's run at kind of that pharmacy rev cycle group. So I think the first piece is we have never seen, since we've been doing the top 10, this truth be more clear than ever before, which is some of the basics of pharmacy revenue cycle have never been more complex. So even when it comes to just the EMR build and coding, what was something that was sort of routine, given the complexities of where regulation and payment models have gone, there's just there's so much room for one thing to be incorrect and cause a million problems downstream with how things are billed. And I would say one of the limitations we've often had on the pharmacy side is that we just don't have transparency to what we actually get paid. We have a ton of transparency on what we're paying to obtain drugs, but very little insight into what we're getting paid for those drugs in a variety of environments. And so this is one of those things that, because it's more complex and is a black box, represents risk, right? And so I think that is what elevated this to the top 10 list for this year and something I wanted to highlight. If we look at the next slide. Again, part of the reason that it's a black box is if you don't understand what you're being paid in terms of the mechanics of how the payments work, what the new market entity and entries have looked like, so as new products, as other sites of care, other restrictions, as payer environment changes, or even what the policy language says, your ability to understand what that cost translates into in terms of revenue and margin is really challenged. And so this is a place that, again, where many pharmacy leaders don't spend a lot of time thinking about their contracts with different payer groups, and that also represents risk. And this is where, when you think about the amount of opportunity there, really having an integrated team becomes the right solution. And so as pharmacists, right, we bring detailed expertise around the medication use, its clinical applications, why we're using drugs in particular ways, in particular patient scenarios. We understand the drug formulations, the specific products, and we need to be able to bring that knowledge to the team. And it needs to be a team that includes revenue cycle, pre-access informatics, compliance, managed care, in order to take a holistic view on sort of the life cycle of a medication claim across our various environments. And so this is something that I think many organizations are in different parts of their journey on in terms of establishing this type of team. And we see that accelerating in 2024 and beyond. It was relatively recent that this idea of a pharmacy revenue cycle, like that term, is only, a few years old. And I think it's going to become a common part of every contemporary pharmacy structure in the near term because of the increase in complexity and the number of dollars associated with it. And if that was not something that is currently as part of your pharmacy structure, if that is not something you as an HSPAL has been exposed to, I think this is going to be a core area for the next 2 to 3 years for people to better understand.
And Dave, I think this is indeed a very low hanging fruit area. We typically find five to $10 million in year one opportunity when we engage with a client on this. And it doesn't take a whole lot of lift to get after it. And before I ask you a question about this, and I do want to ask you a question, I want to point out we've had a few question and answer Q&A submitted in the Q&A box, and thank you. We will address those when at the end of the webinar to make sure you stay on. But we will answer those questions. But in terms of this revenue cycle topic, I think one of the themes of both the infusion strategy piece and the revenue cycle opportunity is pharmacy leaders don't always have, but need to have strong relationships with managed care contracting leaders and revenue cycle leaders in their organization. So those are two people that should be on your radar for taking them out for drinks after work and developing a strong relationship with them. In healthcare, like we all go into it thinking it ought to be a team sport, right? But pharmacy leaders really struggle sometimes to get a seat at the table in the managed care contracting area and in the revenue cycle areas. And those are two areas where well-resourced pharmacy teams can make a quick and significant long-term impact on the overall financial organization, on the overall financial performance. And if you're not at the table, what do they say? If you're not at the table, you're on the menu, right? So with medication revenue cycle becoming more complex than all other areas of healthcare revenue cycle, increasingly as drug expenses are going up, that's what happens because payers want to find ways how not to pay you. What are practical strategies, Dave, that you think pharmacy leaders can get started to shine a light on this opportunity, build bridges, and become part of the solution versus being viewed as an intimidating factor because you're trying to get into the finance and revenue cycle world?
Yeah, why are you poking at things that are not, in your scope today? And first, shameless plug. So Lindsay Amron and Maxie from our team did a podcast with me, and I think we released it 2 or 3 days ago. And we go a full hour basically just on that question about how to get started, what's the opportunity and where. And so if I sold you at all on looking at your rev cycle, I would highly encourage people connect to that resource because what I can do here in 30 seconds won't do justice to what those subject area experts can really get into. But, I thought Maxie and Lindsay's conversation was super insightful. And the recommendation there is really just to ask the simple question with the rev cycle group of like, I just want to understand what we're getting paid in this space. I just want to understand what that reimbursement looks like. I want to be a good steward of our financial resources here. And when I, as a pharmacy leader, don't have clarity on what revenue we're bringing in for this type of specific patient, I feel like I'm not doing my job well. Like, can we collaborate together for me to better understand that? And I thought that is such like a humble inquiry way to go about this. Who can say no to that? What revenue cycle leader can say, I'm sorry, you can't understand your business? And so let's just start there and then let's explore questions from there on, where do we have denials? What do those denials mean? How are we tracking those? Where are those happening within the process? I think many times on the pharmacy side, we're like, well, we know we have prior authorization or pre-certification for our infusions, and we are tracking that. And 100% of the time, they're pre-certified before we dispense the drug, so we're fine. And as you mentioned, Steve, because of the complexity here, we see that may be a false sense of security, and there may be millions behind that rock if people start to look.
So ask the question, and if they say no, take them out for drinks after work, and then ask again. All right, got it.
Stronger drinks. You got it.
All right, let's move on to 340B.
All right. 340B has been the topic, I think, for the last 2 years, just because you can't, shake a Wall Street Journal with a 340B article not falling out of it. And so there's always something in this space, and we just knew that that was not going to change in 2024. So no, I don't need to tell anybody on this call about the continuing challenges to 340B from a variety of fronts that have led to increasing restrictions in that space that have challenged all of us in the health system spaces to provide the type of care for our patients who desperately need it under this type of pricing program that allows us to serve the most underserved in our communities. And so we're going to have to continue to monitor this highly volatile state throughout 2024. I'm not going to say that VSUN has a crystal ball on the future of the 340B program, but what I do know is that this is an environment that's going to continue to change and is going to deserve monitoring throughout 2024. If we look at the next slide. I think we all know the challenges and know that landscape is changing. And I think part of the core then is how do we respond? And to me, we have a list of options here about what we might need to do in order to get after those things. But part of the core of that is how do we just keep our business? How do we keep our patients in-house? Right? Much of the restrictions within this space have dealt with contract pharmacies and other arrangements. And so if we can make sure that we're keeping our patients within our health systems and serving the whole patient, those things become less of a challenge and allow us to continue to serve these patients well.
So Dave, hopefully 340B compliance and 340B optimization is a required educational experience for all HSPAL residents now going forward. But can you share your thoughts with the group on what impact 340B optimization can have for an organization, and how can leaders get started with optimizing their 340B program?
I think to me, 340B not only is maybe about the savings opportunities, but it's like, how can we best serve those patients and how can we create new structures that help support them? And so part of that is, I think 340B provides the types of incentives to help health systems serve their whole patients throughout their continuum of care and make sure that patients are able to get access to those medications and have the support structures alongside them. So it's not just about the dispensing kind of functions, but it's also about the access conditions and how we kind of set up the robust structures to help support these patients. So I think that often can get missed in the opportunities within 340B. And I think from an optimization perspective, a lot of it starts with, do you have the audit and compliance pieces really solid so that you know that what you're doing today is in the right place, so that you can be more thoughtful about where you expand because you know that the core is strong. And I think we see a lot of hesitation from some of our senior leader partners about where to take 340B and how to better serve those patients, because they're not always convinced that the core is solid and that audit and compliance piece is well done and maintained. And frankly, many times when we see that, it's because those teams have been under-resourced in order to really, provide the level of scrutiny that should be required for people to expand those operations. And so I think trying to push past those barriers to get into having the right resources for people to be more comfortable to expand their use of the program is a core part of that strategy.
Great. Thank you. I know we got 10 minutes left and we probably want to get to Q&A. So quick wrap up. One of the things that Kirsten posted in the chat is we have put a lot of effort into developing a very contemporary podcast network called Pharmacy Innovators. So I encourage everyone to go to the VSOT website or to your favorite podcast channel and follow us or like us or whatever it is you do to get it. We've had a number of podcasts on infusion strategy, rev cycle system that have gotten a lot of follows lately. So that's there as a resource for you, and as well as the top 10 article in its entirety or individual articles are all downloadable in a nice PDF version from our website so that people can download this article, share it with your boss. You always ought to be sharing the most important information your boss needs to know with them electronically. Share it with them. Use our top 10 to set up internal discussions. And if there's anything that we can do to help you, feel free to reach out at any point in time. Dave, do you have any like wrap up comments you want to make before we get into Q&A?
Yeah, so I just wanted to do well, I'm gonna let Jenna do the scan me piece here, but to go back to where we started, if you're an HSPAL candidate who's gonna enter those interview settings and be asked about how you stay contemporary, I think thinking through each of these three buckets here of, okay, when I'm thinking about continuous learning and having that plan, as I'm reflecting on where I need to go to take my career next, I would be thinking through some of the things that Steve and I just went through. If we go back to Steve's model of go be an expert every 2 or 3 years in the next hot thing, I would be focused on ambulatory infusion strategy, 340B and rev cycle, and deciding where that is in my plan. And I think the cool part of that is that I don't know that it matters what your title is. Like, I think you probably have ways that you can continue to grow in that space. On the networking side, my encouragement would be grow your network indiscriminately. If you're early in your career, don't be picky. Don't headhunt for only those people who you feel like matter or something within pharmacy. We're all just people. But I would encourage people just to continue to add to your network, because that is going to be how you stay contemporary with big ideas in all sorts of industries. And then have a system to look out into the environment. And I would hope that VSON is one of those things. I think you should have a plan to figure out which daily kind of briefing updates from whatever professional organization or group you follow that gives you what's most relevant to your area of practice, that you have a way to get after that and then build in time to actually do it. I think that is always the challenge as new leaders, is to understand that environmental scanning is a core competency, and we need to build in time to do it. And then, one of the things that Steve has always been good at is like making sure he's always bothering me about what I should be knowing that's happening here in Madison, Wisconsin that I don't know. So having those plans would be part of it. And I think, if you want one quick way to get after it today, scanning this barcode would help you get connected with us as one new resource.
Yep,
Thanks.
thanks, Dave. Yeah, and if you can scan this QR code, and as Steve mentioned, you can find our full top 10 article there, and also a link to our Innovators podcast. Also, you can feel free to connect with Dave and follow us on LinkedIn to stay up to date on all our resources, latest articles, and industry news. And with that, we can move into our Q&A.
Jenna, one of the questions was, will these slides be shared?
Yes, we can share them. We'll share them in our follow-up email.
So we'll share them with everybody who registered. Okay.
Yes.
Okay, great. So I see we have 4 questions. I think we got a comment maybe from Tim Miller, but we'll take these questions as they came in and see how Dave and I can tap dance as we answer these questions here. So one of the major requests, I'm just going to read the question. One of the major requests for staff surrounds working from home as a part of improving wellness. How do we foresee this playing out in a career in a health system pharmacy setting where pharmacists have a hands-on role in dispensing meds to patients? So I think the question is, what do we see as the future from work from home? Dave, you're the expert here.
Steve says that because Jeff Little and I had a debate on work from home 2 years ago at the mid-year meeting, and I was the dissenting not work from home person. So I think work from home in a hybrid approach is going to be something that health systems are going to continue to pursue. I think we should, there's been increasing data that has come out over the last 6 months around the impact of work from home on promotions, which is funny because that's exactly part of the argument I made, which is if you're one of the people who work from home, you're less likely to get promoted.
You're still trying to win the debate, Dave.
I know. Well, I won it the first time and I'm going to try to win it again. I would say I I think that there will be continued challenges to the work from home model. I think what we need to be able to do is to provide better autonomy for how people spend their time. And I think sometimes I was just having this conversation with a colleague and former resident earlier today. I think work from home is actually a surrogate for having people have more autonomy over how they spend their time during the day and less about the ability to actually work from home. When you talk to folks, it's like, I want to be able to have some control over when I work and how I work. And I think we're going to have to become more flexible in that space. And it's going to take technology and new models for us to get after it.
And Dave, I'll just add, one of the things I've learned being in consulting over the past 3.5 years is you don't build relationships over videos. You build relationships in person, and relationships matter to one's individual success, to trust. So I don't see doctors and nurses out advocating, oh, we want to work from home. I'm sure I'm missing some stuff there. But the reality is there's pockets of pharmacy workforce that make sense to do some of the work from home. I would advocate that it's going to continue to grow, especially for like prior auth type roles, medication access, and, perhaps some pharmacy IT roles. But I would suggest that, some level of rotation where all work from home members still have an in-person opportunity, and people that work predominantly, like you're a patient care provider, you're going to have to be part of the team, have great relationships with doctors, nurses, and patients. In general, I don't see the majority of the pharmacy workforce successfully working from home, but there are roles as you develop a system approach to pharmacy. You can certainly centralize and have all of your employees have the opportunity to rotate through work from home settings so that everyone gets to enjoy that, to help contribute to a little bit better control over one's life on some days, would be my answer to that question. The second question, I keep hearing about health equity and meeting our patients at their health literacy level at my organization. With meds becoming more complex, true, how do we position a pharmacist to step into that role knowing it's not directly profitable?
I think to me, that is more of a question about how do we position or build a business case than it is necessarily about whether it's profitable or not. I believe that what you're describing there is exactly something that could be highly profitable. Like, I think it is like, how do we identify the patient populations that need a pharmacist level of care? And then how do we make sure that we're quantifying what it means to keep those patients filling within our pharmacies, within our specialty med management programs, how we're getting those infusions within our infusion suites. Like, I think those are all great reasons why we should be investing in pharmacy. And I think we need to look at, I know it's like weird, right? Because in some ways it feels like a step backward. We've been trying to separate ourselves from the product. But right now, like, there are good reasons financially to still tie us to the product in some ways and say, let's try to figure out how we keep this patient and this high risk, complex, high cost drug within our health system and serve this patient. And there will be a financial benefit associated with it.
And there will never be a good substitute for pharmacy leaders to being able to develop a good business case.
No.
And I'll tell you what, Dave, half of health system patients are capitated in the acute care model.
Yeah.
And a lot of the patients that struggle with health literacy, I would venture to guess a lot of them are in that capitated payment bucket. And so keeping them knowledgeable of their meds, taking their meds properly, on the right drugs, off the right drugs, and out of your ERs and out of the hospital has a direct bottom line impact to the organization. So I would advocate strongly that it doesn't grow revenue, but it improves the organization's financial performance by helping those patients be well in their communities through a pharmacist being focused on literacy health efforts. So I think it's a great area to challenge a resident to develop a business case, and as a year-long residency program to help develop that program internally in your health system. Next question, 1 minute. Have y'all, this question's coming in from Alabama, have y'all seen health systems changing their patient definitions to maximize 340B savings following the Genesis versus HRSA decision? Short answer is we have seen some clients doing this. There's a variety of approaches and risk tolerance. We see organizations that compliance and legal have zero risk tolerance for this. Others being fully aggressive, but mostly a lot right in the middle. David and I are neither one experts. Angela Diani on our team spends, day and night thinking about these types of issues. And if you have specific questions about it, reach out to Dave or I, and we can connect you directly with Angela to have a discussion. But short answer is yes. We don't see it in most of our clients, but we see it in a few.
Right.
And, you know, there's some skepticism about how long that will help as a strategy. But right now, there are some organizations that are saying we can't afford not to do this. There's also other innovative approaches to optimizing 340B eligibility that we think are probably less risky. Don't have time to get into those right now, but there's a number of strategies to improve eligibility, and the patient definition is just one. And Tim, thank you for your comment and your support of our messaging today. It's much appreciated.
Yep.
So I think that's what we have time for.
Yep. Thank you everyone for attending today. And thank you, Steve and Dave, for giving an excellent presentation. Again, we'll be sending a short survey after this, and also I'll follow up with the email with the recording and the slides. And we look forward to seeing you at our future webinars. Thank you.
Bye, everyone.
Bye, everybody.